We have Evelyn on the phone who has a question that Dr. Martin's going to help us out with. Evelyn, are you there?
I am.
So, Evelyn, what's going on?
Well, they did some tests on me and confirmed that I had a TIA. My main concern is, should I be concerned about having a major stroke?
And just so everyone knows what Evelyn says when she calls it a TIA, transient ischemic attack, lack of blood flow to your brain that resolves within a 24-hour period. Very scary phenomena.
It's very scary, but sometimes people don't get as concerned as Evelyn does, and they miss an opportunity to cut off a stroke that's destined to happen. These are warning signs for a major stroke in many cases. Now, the most serious TIAs are ones that cause a temporary paralysis of one side, speech impairment. They're the ones that last more than 60 minutes. Those are the really dangerous ones. If those sorts of TIAs happen, if those real red flags occur, you have to be admitted to the hospital, evaluated immediately, and you may require urgent treatment. What do we think about in these patients as the underlying cause? Well, we think brain, blood vessels in the neck, and heart. Those are the things that you have to attend to. There can be blockages of blood vessels in the brain, and sometimes a brain tumor will mimic a TIA by causing mini seizures. You have to think about the carotid artery in the neck where plaque can form and clots can break off and cause blockages downstream. And you have to think about the heart. Valvular disease can kick off strokes. And we've got an animation here that shows what's happening in one of the blood vessels in the neck. When a little plaque breaks off of an atherosclerotic lesion, it can go up into the brain, temporarily block the blood flow, and that will cause a temporary dysfunction. We can see that discolored area in the brain that is not functioning normally. In the case of a permanent stroke, a much larger clot lodges at a basal branching point, and a large area of the brain is deprived of blood flow, and that may not break up. If that doesn't break up, and if the circulation is not restored within 3 to 5 hours, then brain cells die, the tissue is damaged, and a permanent stroke occurs. So, Evelyn, for your sake, what's critically important to do is to make sure that you have brain scanning, probably an MRI scan, carotid artery imaging to rule out a serious plaque, and an EKG and possibly an echocardiogram to take a look at your heart to make sure that you don't have some underlying problem that is announcing itself through these transient symptoms that might cause a permanent stroke. The good news here, all of those things have effective treatment. So it's good that you're concerned. You've got a window of opportunity to cut off the occurrence of a stroke, but you do need those follow-up evaluations to look into these possibilities.
Evelyn, we wish you the best of luck.
Thank you so much. I really appreciate the information.